Senator from New Hampshire.
Mr. President, I appreciate the comments of my colleague from Arkansas about the challenges of the heroin and opioid epidemic. I think it's really a pandemic that we're facing in too many states across this country. Certainly it's a huge issue in New Hampshire, my home state, where we have the highest percentage of deaths from overdoses of any state in the country. And in a few minutes, we're going to be voting on the Comprehensive Addiction and Recovery Act, which is an excellent piece of legislation sponsored by my colleagues Sheldon Whitehouse from Rhode Island and Amy Klobuchar from Minnesota, as well as my colleague from New Hampshire, Senator Ayotte and Senator Portman. We are also going to be voting on a number of amendments, including the amendment that I have proposed, which is emergency supplemental funding, to make sure that the changes we're making as the result of the CARA legislation actually get the resources that need to be provided in order to make those changes work. In 2014, more than 47,000 Americans died from lethal drug overdoses. Each day, 120 Americans die of drug overdoses. In New Hampshire, we're losing more than a person a day from drug overdoses. Last year, 3 times as many people as we lost in automobile accidents. And these are numbers that we've been using a lot on the floor of the Senate in the last couple of days. But I think they're numbers that we need to continue repeating and repeating, because that we are losing 47,000 Americans from drug overdoses is just not acceptable. And everywhere I go in New Hampshire, I'm told one thing consistently by drug treatment professionals and by law enforcement, and that is that they need more resources, and they need them now. Health workers are being overwhelmed. Nationwide, nearly 9 out of 10 people with substance use disorders don't receive treatment. They're being turned away. They're being denied treatment because of a chronic lack of resources. The amendment that Senator Whitehouse and I have proposed addresses this problem. It provides $300 million in emergency funding for the Substance Abuse Treatment Prevention and Treatment Block Grant Program. This is funding that will save lives in our states of New Hampshire and Rhode Island, in the state of Arkansas, in the presiding officer's home state of South Carolina. This is funding that will save lives in each of our states. Not only are treatment health workers being overwhelmed, but law enforcement officials are being overwhelmed. We need an infusion of funding to mobilize additional efforts to stop opioid traffickers and drug dealers. And this amendment, this emergency supplemental amendment, would allocate $230 million to the Burn JAG program to directly combat the opioid crisis. These are efforts that will keep drugs off the streets. In total, the Shaheen White House amendment appropriates $600 million in emergency funding that will be immediately available to states and to those who are working on the front lines to address this crisis. I think that's why the National Governors Association, the Fraternal Order of Police, the American Public Health Association, the American Society of Addiction Medicine, the American Academy of Pain Management, the American College of Physicians, the National Association of State Alcohol and Drug Abuse Directors, and so many other groups support this amendment. And again, the critical point here is that this amendment funds key provisions of the CARA bill. The Comprehensive Addiction and Recovery Act is a good bill. It's excellent work that so many people have been involved in. The sponsors did great work in writing the legislation. I support it. I'm a co-sponsor. But it's an authorization bill, and that does not provide funding. So if we support making the changes in the law that are included in the CARA bill, we should also support providing emergency funding to those same programs. To all of my colleagues in this body, we know that doing the same thing is not working. Every year, more and more people are dying from drug use. Congress needs to rise to this challenge, just like it has in previous public health emergencies, because make no mistake about it, this is a public health emergency. And we've had a history of providing supplemental funding to address those public health emergencies. In 2009, Congress appropriated $2 billion in emergency funding to fight swine flu. That's a bill that passed the Senate 91-5. Many of us who voted for that are still in this body. And just last year, Congress approved $5.4 billion to combat the Ebola outbreak. That's an outbreak that killed just one person in the United States. Compare that to the 47,000 people that we lost in 2014 to drug overdoses. Surely Congress can come together now to fight this raging epidemic that's right here at home. We can't avert our eyes from the 47,000 Americans who were killed by lethal overdoses. We can't accept that 9 out of 10 Americans with substance use disorders don't get treatment. We can't ignore the fact that law enforcement officers and communities across this country are overwhelmed by aggressive drug traffickers and a rising tide of opioid-related crimes. The $600 million in emergency funding that's in the amendment that I'm proposing will help stem the tide. It will make a powerful difference in communities all across America. CARA is important legislation. I intend to vote for that. I hope this body will pass it. But I urge my colleagues also to support the amendment that makes sure that we have the urgent emergency funding to ramp up this fight in the months immediately ahead. Passing CARA without any funding is like offering a life preserver to people who are drowning and not putting air in that life preserver. This is a nationwide crisis. It is way past time we mobilize a nationwide response that is equal to the challenge. Thank you, Mr. President. I yield the floor.